How to do a tracheostomy. This is our patient. Anaesthetize the patient, place them in dorsal recumbency with the neck extended and the ET tube in place. You want to clip and prepare the ventral cervical region. Make a 2 to 5 centimetre incision in the midline, caudal to the cricoid cartilage. The soft tissues over the trachea are bluntly dissected and retracted laterally. The peritracheal connective tissue is removed from the region of the tracheostomy site. The ET tube is withdrawn slightly cranially to ensure that it is not perforated. Here is our trachea. The head is that way and the tail is down the bottom there. These are the tracheal rings, the cartilage rings. You want to incise longitudinally through 2 adjacent tracheal rings. And then you want to incise horizontally, like this, to make a trapdoor effect. And that looks like this. You want to incise longitudinally and then horizontally to make a trapdoor. Place stay sutures on both sides, here and here, of the vertical incision to allow lifting and opening of the incision. Leave in place and label left and right. And what that looks like is this diagram here. The stay sutures are labelled left and right, and you've got a trapdoor incision. Insert the tracheostomy tube. So we've got these tubes here. The sizes are on the back. Insert the tracheostomy tube and loosely suture the skin incision. Too tight an incision will lead to subcut emphysema. Secure the tracheostomy tube around the neck with umbilical tape or using the materials provided in the kit. Every kit is different. Ideally, a filter is attached to the tracheostomy tube inlet to reduce dust aspiration and to humidify the air. This needs to be changed daily. The complications of a temporary tracheostomy: airway obstruction, tube displacement, hemorrhage, infections, subcut emphysema, tracheal mucosal injury, and necrosis. To care for the tube, we need to follow this protocol here. It talks about cleaning, suctioning, and replacing the tube. So suctioning every 4 hours. Aseptic technique is to be used. Oxygenation is to be provided prior to suctioning. It talks about using sterile saline and passing a little feeding tube down and suctioning with the suction kit. Providing flow by oxygen after each suctioning episode and cleaning the incision around the tracheostomy tube.